Hi, I'm Dr. Chuck Reinertsen. Did you know the mouth is the front door to the rest of your body? I mean, whatever happens in here doesn't stay here. It goes through the rest of the body because we have a bloodstream. And that bloodstream will carry bacteria from the mouth to the heart, to the brain, the pancreas, the joints, everywhere. And the challenge is most dental infections have no pain. So we're going to try and help you connect the dots between what's happening in your mouth and what's happening in the rest of your body. So stay tuned to Your Filthy Mouth.
Your smile is beautiful and possibly deadly. Dr. Chuck is here to tell you how your mouth can hold the key to your overall health. Now, about that filthy mouth of yours.
Hi, welcome to Your Filthy Mouth. I am Suzanne Lynn with Dr. Chuck Reinertsen, and we're so glad that you're here. We are going to be talking about everything mouth related, specifically what happens in your mouth and how it's affecting the rest of your body. So make sure you subscribe to the channel because we want to make sure you know when the new shows are coming up. So, all right, Dr. Chuck, tell us about you and why you're so passionate about what you're doing.
I graduated dental school back in 1979. And back then, I can remember as students, we went to some of the instructors and said, hey, what about the infections in the mouth? Aren't they going to affect the rest of the body? And at that time, we were told that, no, there's an oral barrier that keeps the bacteria from getting into the rest of the body. People were told there's a placental barrier that keeps bacteria from getting into a developing baby. Or there's a blood-brain barrier to keep different toxins from getting into the brain. Well, the facts are, there is no oral barrier. Whatever happens in the mouth goes everywhere. They're babies that are born that have oral bacteria inside of them that has caused
because it's going through the bloodstream.
Going through the bloodstream, going through the placenta. There's oral bacteria found in the brain. They're finding that in Alzheimer's patients. So the fact that we talk that there's a barrier, there's no barrier. Whatever happens in the mouth gets in the bloodstream and it's going everywhere in your body. So when about 4 years ago, I went to a conference, and this conference was doing just connecting the dots. So we're talking about how the bacteria here affects the heart, how it affects the pancreas, how it affects strokes, diabetes, Alzheimer's, rheumatoid arthritis, pregnancy complications. And it's a really big deal. And the big challenge we have is that physicians were never trained to do an examination in the mouth.
But the mouth is part of the body. How?
Well,
I don't understand.
A lot of physicians were taught that the dentists have the mouth covered. Don't worry about it. They've got the mouth covered. Challenge is there's so many things happening in the mouth that don't stay in the mouth. They get into the bloodstream and they go everywhere. Like I said, they go to the heart, they go to the brain, they go to the pancreas. And that's why you have such a big effect on diabetes, on heart attacks, on strokes, because whatever's happening in here is going into the arteries, changing the arteries, a hunk of plaque. Well, what do you call the stuff that builds up on your teeth?
Plaque.
What do you call the stuff that builds up in your arteries?
Plaque.
Okay.
Right.
They're not exactly the same, but it's the same basic idea on that. And can the oral bacteria affect the cardiovascular plaque? Absolutely. They've already shown that. So this is not, we're not the researchers. We want you to go to the webpage, yourfilthymouth.com, and please look at the links that we have, because it's going right to the research, to the literature, to the studies that are showing how this is so important.
So I'm not really like a left brain person, like research oriented, but one of the links we're linking to talks about how like post-mortem in, what do you call that? Autopsies and stuff, how the germs, how the bacteria in their brain was the same bacteria from the mouth. So truly it's traveling, and that's affecting people with Alzheimer's and stuff.
Common sense is so uncommon. And, you know, we like to think, if it's happened here, it's going to stay here. No. Common sense says that when we have a bloodstream, if you put something in that bloodstream, it's going to go through your body. Have you ever been put to sleep to have surgery done?
Sure.
Okay. When they stick the needle in your arm and they say count backwards from 100, how far do you count?
Oh, maybe 98.
Yeah, it's pretty darn quick,
yeah,
okay?
Yeah.
You know how fast that anesthetic went from your artery here to your brain to put you to sleep? Seconds.
Wow.
Just seconds.
Wow.
You know how long it takes for the bacteria in your mouth to go through your whole body? Seconds. Just seconds. So it doesn't take, it'll build up over years, decades, because there's no symptoms, you're not getting it taken care of. But it goes from here to your body that fast.
Okay. So when we're going to the doctor, we've got these problems that maybe the doctors are just treating the symptoms of. Why are they not saying, when's the last time you've been to the doctor? Do you have an infection in your mouth maybe?
Physicians follow a protocol. Okay. And we do this, and this. And somewhere along the line, having the mouth examined was never in the protocol. Okay, because that's the dentist and they've got that covered. Don't worry about it. Well, we can't do that anymore.
So it's just the way we've been doing things,
It's
basically, right?
It's tradition, it's habit, it's the way we've always done things. But we have to look and realize that things are changing. If we look back and look at some of the advertising that was done in the early 60s and the late 50s about cigarettes, there are many full-page ads with physicians recommending cigarettes to their pregnant women.
We're going to have to post that.
Yeah,
because that's funny. I mean, it's funny now looking back. Like, it's so absurd. It's ridiculous. Who would do that?
Who would do that?
Right,
okay,
right.
But that's what they knew at the time.
Right.
And we have to look at, this is what we know at this time. And in 5, 10, 15, 20 years, are we going to know more? I certainly hope so. But I hope we'll be connecting the dots, and we'll include the mouth as part of the body. So one of the things that people can do is the next time you see a physician, ask them, why don't you ask about my mouth? Or have you ever thought about asking about the mouth? Because until there's enough of a groundswell of patients asking their physicians, we're going to keep doing the same things we've always done.
Right. Love it. All right. Hang on. We're going to go to the question of the week next.
Here's Dr. Chuck's question of the week.
Hey, Dr. Chuck. I'm Kayla, and I'm wondering, what is the official best technique to brush your teeth? I've heard up and down, but I've also heard to go in circles. Does it really matter?
Well, first of all, I'm in favor of brushing your teeth.
Okay.
I think that's a really
I'm shocked being a dentist. Yeah. Okay.
No, when I was growing up, every time I went to the dentist, they had a new way of brushing their teeth. First, it was just get in there and scrub them. Then it was up and down. Then it was down on the uppers, up on the lowers, 45-degree angle, go in a circle, every different way.
I remember a lot of them. Yeah.
Okay.
Yeah.
I could care less. I'm not hung up on the technique that you use for cleaning your teeth, but I'm really hung up on the results. So whatever method you're doing, clean with electric toothbrush, manual toothbrush, dental floss, water irrigation, interproximal picks, any of those things. But the key is at the very end when you're finished cleaning your teeth, get a disclosing tablet. These are the little pills you can get them on Amazon. There's different places you can get them. They're very inexpensive. But what you do is you chew one of those things up, and then it'll stain the bacteria, the plaque that you missed. If it's new plaque, it's going to be pink or red. If it's old plaque, it's going to be purple or blue.
Okay.
Now go back and clean that off, and that's when you learn what it really takes to keep your teeth good and clean.
All right. I'm going to do a follow-up question to Kayla's. Still 3 times a day? Is that pretty standard?
I'm of the opinion that if you do it 1 time a day right, it's better than 3 times a day wrong.
Wow.
Okay? But you've got to do it right. You can't do it wrong and think it's okay.
Okay.
If you want to do it 1 time a day right and 2 times a day wrong, that's fine. It takes between 5 to 7 minutes to properly clean your teeth. You can't do it in 30 seconds or less, which statistically, 30 seconds or less is what the average person spends brushing their teeth.
Wow.
That's not much.
Right.
So we've got to spend that time, get the bacteria off, check ourselves with the disclosing tablets, and again, no matter what technique you're using, as long as it's getting the bacteria off of the teeth without damaging the tooth or the gums, that's fine.
All right. Kayla, great question. Awesome. And you know what? If you've got a question, you can go to Your Filthy Mouth. You can actually click the record button and just talk into the microphone and record your question, or you can write to us just like Kayla did.
Yeah. And we want your questions. We want them.
Well, that wraps up this episode of Your Filthy Mouth. And make sure that you hit subscribe so that you get the new shows. Check out the links on Your Filthy Mouth website and ask questions and find out a lot more. There's actually products that you talk about, the disclosing tablets and stuff. You can buy them all at Your Filthy Mouth. So what are the 3 takeaways from today's show?
Well, number 1, your mouth is the front door of your body, and this is where things are coming into your body. Number 2, the research has already been done that makes the connection between what's happening in your mouth, what's happening in the rest of the body. Go to the links that we have. We're not making this stuff up.
Right.
Number 3, there's certain things that you can do about that. And the main thing you can do is clean your mouth really, really well. And when you see your physician, ask your physician, why don't you ask about my mouth? Okay, the mouth is the biggest polluter of the bloodstream. Physicians were not trained, so if we want to take this to the next level, ask your physician, hey, is my mouth important for my health? And just see what their answer is.
So maybe like if they're experiencing headaches or things are going on, maybe they're on blood pressure medicine, be bold and ask the question, could my mouth somehow be linked to this?
Oh my gosh, if you've had a stroke, could my mouth be linked to it? If you had a heart attack, could my mouth be linked to it? Wow. If your insulin is not working properly with your diabetes, could your mouth be a part of it? All these different things. We have to rule out the mouth as a source of the infection. Otherwise, it's just going to keep on dumping its byproducts into the bloodstream. It's going to mess up our whole body.
Wouldn't it be great if we could get rid of the medicines and stop treating the symptoms because we found the source of the problem?
That's the whole idea, is let's get to the source, not just the symptom.
All right. Any final words of wisdom?
Well, I'm copying a comedian from years ago, Soupy Sales. I don't know if you remember
remember
him.
Soupy.
You remember Soupy
Yeah,
Sales?
yeah.
And he would say, be true to your teeth, and they'll never be false to you. And I like that.
Love that. Looking forward to seeing you next week, and we're going to put some coffee on for you, too.
Perfect.
This has been Your Filthy Mouth, a weekly podcast about how what happens in your mouth affects the rest of your body. This is important information, so please share it with your friends. Don't forget to hit the subscribe button on YouTube, iTunes, and all the other podcast sites. And drop by yourfilthymouth.com to ask Dr. Chuck a question or find dozens of links to information about oral systemic health. We'll talk to you next week.